advocate began when my son was born. He was diagnosed as a baby around 9 months of age with mucopolysaccharidosis, or MPS type 2. And I remember at the time we were seeing a paediatrician quite regularly because he had lots of tummy pain and lots of feeding issues, and he wasn't sleeping much, and neither were we. And one day we came out with, instead of any real answers, we came out with a diagnosis that changed our life. And I often feel like we came out with more questions than answers. And I think I first started advocating for policy change when my son was about 7 years of age. There was a treatment for his condition that was available overseas, but it wasn't available in Australia yet. And I remember I rang the pharmaceutical company and asked them how long it would be until we could access it in Australia. They told me that there was still a number of hurdles to get through, but if all went well, that it may be available in 18 months' time. And I remember I asked them, how can I make it quicker? And they told me to lobby government. So I quit my job as a part-time social worker, and that's what I did. I didn't really know what I was doing, but I learned along the way, and I learned the strategies that were more effective, and I learned what was less effective. And I also learned that advocacy, when it's done right, does work. And long story short, my son was able to start treatment 9 months later. So the advocacy effectively halved the wait. RVA advocates for the best outcomes for Australians living with a rare disease, and our focus is on policy development and change and systemic advocacy. There's a number of challenges facing people and families living with rare disease in Australia. There's a lack of awareness and education, both for people and families living with rare disease, but also for health professionals and other service providers, as well as a lack of awareness in the general community. There's a number of rare disease workforce gaps, and there is a real need to develop a national rare disease workforce strategy that responds to current and future demands, including the impact of genomics and other technology. Diagnostic delay and misdiagnosis is still common. And in Australia, rare disease care and support is quite fragmented and not integrated. Some of our health in Australia is implemented at a national level, but most of it is at a state level, so there's a lot of inconsistency. Health and disability services in Australia are very separate, and we often hear of cases of people living with rare disease often falling through the gaps. Our systems are difficult to navigate. There's often a report that feel lost in the system. There are limited treatments in rare disease, and even when they are developed, it's common in Australia to know that there are treatments available overseas, but it seems we're often a later market, and we often have to wait for those treatments. And even when the treatments are developed, the reimbursement or funding of those treatments are challenging. In 2018, the Federal Minister for Health announced funding for RVA to collaboratively develop and deliver the National Strategic Action Plan for Rare Diseases. And this was the first nationally coordinated effort to address rare diseases in Australia. RVA, in mid-2019, RVA embarked on an extensive and nationwide stakeholder consultation that involved all stakeholders in Australia's rare disease sector. And following that consultation and the development of the plan, the Minister for Health launched the action plan in February 2020 in the lead up to Rare Disease Day. And ever since, RVA has been leading its full implementation. The action plan is comprised of 3 core pillars: awareness and education, care and support, and research and data. And each pillar is interrelated and outlines priorities, actions, and implementation areas. The vision of the action plan is to enable the best possible health and wellbeing outcomes for Australians living with a rare disease. So there has been much progress for Australians living with a rare disease and their families, particularly in recent years in Australia, but we have much more work to do to fully implement that action plan. One of the 4 critical enablers of the action plan is state, national and international partnerships. And given the small populations and complexity involved in rare disease, strong ongoing partnerships and collaborations are essential